So the U.S. diabetes conversation maps were developed by a team of people beginning in 2007. The team consisted of 2 nurse educators, I was one, a person with diabetes, which we felt was absolutely critical, and a nutrition expert. And our purpose was to develop a way of providing education that was different than how education was often done then. At that time, patients were just sort of in a room. They were getting lectures and PowerPoints about their beta cells, and there wasn't a lot of conversation. There wasn't the opportunity to answer or ask questions, and there was very little emphasis on the psychosocial and behavioral side of diabetes. So the maps were designed to be used differently by educators in a group or one-on-one with patients. And we made sure that we included both the psychosocial side and the behavioral side. So we taught people how to begin to make some of the many changes that you need to do with diabetes. We created the maps in order to match the standards for quality education. We included all of the recommended content areas, but the method for delivering that information was meant to be patient-centered and patient-driven. So the maps became a tool that we could use to have a conversation with a group of people, help them to understand diabetes, but more importantly, to help them understand their experience of diabetes. So the maps have been rolled out not only in the United States, but in many countries around the world. They vary slightly to make cultural and language adaptations, of course. But the goal and the methods remain the same, which is, again, to be very conversation-driven and take us away from just the medical aspect, to take us away from just the management side of diabetes, but to also focus on the self, that part of self-management that we spend less time on often as educators. So really to help people integrate diabetes into their lives and make it part of their daily care and routine, and to address some of the issues that they face and some of the struggles that they face as they care for themselves. So the maps have been used successfully, outcomes are improving, and we find that people really like them. They come back. And one of the issues educators face is people come to one class and they don't come back, which is kind of a sign that maybe your education isn't so great. And so the maps have engaged patients and helped them to become more actively involved in both the educational and the care process. And so they work, and they work well.